Welcome back to the video, everyone. Again, as a guest, we have Danny Bossa. Welcome, Danny.
Hey, Steven. How are you?
Hi, I'm fine. So what about the doctor is saying to get off TRT to test the baseline levels? A common thing. What's your opinion?
This is the TRT and Hormone Optimization YouTube channel. And if you want to learn all about the science-based information on this topic, consider subscribing, hit that notification bell, and you'll be on your way.
Yeah. So in the Facebook group of the same name, TRT and Hormone Optimization, we just hit actually 6,000 members. By the way, guys, just a quick note for those of you who ever tried to join that group and got declined, we will automatically decline anyone who doesn't answer those 3 questions you get asked. There's 3 basic questions, and if you only answer 1 or you answer 2, you don't answer all 3, it's an auto decline. So if everybody who's trying to join the group would have answered all 3 questions, there'd probably be somewhere around 60 or 70,000 people in that group right now. There's only 6,000, so you can figure out pretty quickly that we probably decline about 9 out of 10. They're just not answering the questions. So if you're really serious about learning about TRT and you want to join that group, it's free. You got to answer those 3 questions. Okay, that's all we ask. It basically weeds out the ones that are not serious and allows us to approve the ones that are serious. Because if you're serious, you'll answer the 3 questions. Lots of guys coming into the group talking about their doctors, they may be transferred over to a new physician. And the physician is saying, I'm not entirely sure about this whole TRT thing, and I don't really trust what your previous doctor did or what tests they did. Maybe your doctor is full of crap, and I want to make sure that if I'm prescribing you testosterone, that I'm absolutely sure that you need it. And they want to get men off their TRT to test their baseline levels. We see it all the time, and you know how annoyed I get in these videos that we do about AI use or using an aromatase inhibitor blocking estrogen. This one actually supersedes that. This is probably the one that annoys me and pisses me off the most. So if you are somebody who is currently dealing with a physician trying to convince you to get off your TRT, or if you are a physician who tells your patients to get off TRT to test the baseline levels, this video is for you. So for the guys watching that are going to the doctor, you can send this video to your doctor. And if you're a physician doing this, I want you to listen to what I'm saying very, very, very carefully. And then I would invite you to comment in this video as to exactly why you would even conceive of suggesting such an utterly, demonstrably ridiculous, asinine, insane thing to do. Okay? So get into the office. Physician's checking you out. You're currently on TRT. Your dose is this. You're doing well, but you got to change physicians. Maybe you moved. Maybe the physician passed away, closed his practice. Who the hell knows what the reason you got to change physicians? To the physician in question, first of all, I'm asking myself, why is it that you do not trust what the previous physician was prescribing? Is it because you're better than all previous physicians? You don't believe them. You don't want to take on the responsibility because maybe testosterone is dangerous and you don't want to prescribe a dangerous drug. And second of all, is what I'm trying to figure out is, what is it exactly you're expecting to see when you tell people to get off TRT to test baseline levels? So what that leads me to believe is you're telling the patient, hey, I want you to get off TRT and I want to see if you really are deficient, right? Because if they're not deficient, they don't warrant TRT. If the guy's been on TRT for a given amount of time, his natural production is suppressed. Everybody knows this. For some reason, you guys don't know this, but everybody seems to know this. So the doctor doing this, I'm asking you straight out the question, what are you expecting to see? What is the outcome you are expecting to see? Have you ever had a patient that you told to get off TRT and that they magically had 800 nanograms per deciliter total testosterone? Has it ever happened? Has it ever happened that you looked at the lab and say, hey, look, you got fantastic levels of testosterone. You don't need TRT. No, it's never happened, ever. Why? Because when you're on TRT for any extended amount of time, your natural production stops. So as soon as you tell the patient to stop taking testosterone, their levels are going to plummet, correct? They're going to get to virtually nothing. So you're going to test the virtually nothing and you're going to say, oh, you got virtually nothing. Well, now we have to wait and see when your natural production comes back, how much your natural production is, right? That's the exercise. So in some men, their natural production will come back to whatever it was before. In other men, it'll come back to less than it was before. And in some other men, it may not even come back at all. Okay? So you've actually got a very small chance of anything promising with this exercise. Now, I want to go over the harm you're causing, because doctors are supposed to be doing this to help people. You're supposed to be helping them not get sick, helping, preventing them from harm, trying to improve their health. Instead, you are harming them. Why? The very first thing that's going to happen when you tell them to stop taking their testosterone is, very quickly, sexual dysfunction will kick in, okay? Their libido is going to tank, their erections are going to go away. Now, ask yourself what that's going to do to their relationship. The amount of strain and stress on the relationship where maybe everything was great and suddenly it's not so much. All right, you may be causing divorces, you may be causing breakups. You're definitely going to be causing stress no matter what. And stress, we know right away, is not very good. Next thing is going to kick in is going to be brain fog. You're a cloudy head, you can't think straight, you're just kind of going through your day in a daze, you just don't feel the same that you felt before. No clarity of thought, no quick thinking, you're just kind of in this muck. And I've done that before. I've been put in that situation and I remember the feeling, and it sucks. The next thing you may have is going to be insomnia. You can't sleep because your testosterone levels are absolutely tanking. Your hormone profile is in the gutter. A lot of guys, when they're in that situation, they're going to get insomnia. They're not going to sleep well. So now you have the stress of the relationship issues because of sexual dysfunction, and you're not sleeping. You're probably going to get some symptoms of depression, because you're sure as hell not going to feel very good. Motivation is going to tank. Your drive is going to tank. Your energy levels are going to tank. So how is that going to benefit you in your day-to-day life, with your job, with your company, with your employees, with your friends, maybe, your drive to go to the gym? All that is going to tank. Every single day is going to be a struggle. It's going to be a real struggle. Any amount of muscle mass that you had, guess what? When your testosterone levels are tanked, I don't care how hard you're working out, you're going to start losing muscle mass. How much of it is going to depend from person to person, but you will lose muscle mass. And you will most likely start gaining fat mass. There are guys in the group that literally put on 100 pounds, saying, I did not change one iota of my diet. Literally, it was like just whatever I was eating, I was just getting fatter and fatter and fatter, and my muscle mass was shrinking. And you see the before and after pictures just from a 6-month period, going from fairly decent shape to obese, because their hormonal profile is a disaster. So physicians, I want to ask you, why would you put anybody through that kind of torture? But they're not just going to be through that kind of torture for a couple of weeks. You might need 6 months to see where their levels are. So over a period of 6 months, their levels might kind of slowly creeping up and creeping up. Now it gets to the point at 6 months and you say, okay, well, let's check your natural levels. Okay, so you've got 320 total testosterone. You know what? Okay, maybe I'll put you on TRT and we'll get you better. What do you mean get you better? The damage is done. The guy's relationship is shot. He probably lost his job. He's probably put on a ton of fat, lost muscle. The guy's a wreck, but now let's make him better by getting him on TRT. So now what? Now you're going to start giving him TRT. Now he's going to get his levels back up. All those hormones are going to be adjusting. He's probably going to have his insomnia and whatever else, adjusting to all this until he gets better. You've destroyed the guy, okay? This isn't a question of you trying to decide whether or not you want to sell plutonium to somebody. You want to make absolutely sure they're not going to create a nuke from this plutonium, right? So you're going to do every single study, every single question possible to ensure, like, okay, I can sell this guy plutonium and I'm sure it's going to be fine. This is not something like that. We're talking about testosterone, okay? This isn't something dangerous. This isn't something that's going to hurt him or kill him or cause him any harm. It's a naturally occurring substance in the body. It's a naturally occurring substance in the body that men need to thrive. If you take that substance away from a man, the man will not thrive. Why would you want to chemically castrate a man? To do what? To what end game? I want to see what your natural levels are. You won't have any natural levels. They're over. They're done. I don't get it. I don't get it. And some of you doctors that are saying, I'm only going to give you a little bit of testosterone, but we're also going to give you something to help your natural levels. So I don't have to give you so much testosterone. If the body was producing enough testosterone as it was, the guy wouldn't need testosterone, right? Because his body's producing enough. You got guys that aren't producing enough. So instead of just saying, okay, well, the hell with the natural production, let's just give you testosterone and be done with it. You're like, no, I don't like giving testosterone because, let's just give you a bit of testosterone to help, but then let's try everything in our power to try to coax your body to make more. Let's try to coax your body to do something it clearly isn't able to do right now or doing terribly, but let's try to stimulate that process. And this way here, I only have to give you a little bit of this really dangerous drug that's going to cause harm. It drives me nuts. Patients going to see a doctor, if you're going to see a new physician and he wants you to tank your testosterone levels to check your baseline levels, turn around and run for your life. Physicians that are doing this, you are causing harm. You are not helping the patient by any stretch of the imagination. You are causing harm. The devastation of having no testosterone in your body for months at a time. You know what? You should maybe try chemically castrating yourselves for 6 months to see what that's like prior to you telling any patient of your own to do that. And then maybe you might have some iota of an idea what it is you're suggesting. Okay, so physicians that are watching this video and still believe this is a good idea, comment down below to explain to us what possible reason you'd have to do this, because I'd love to hear it.
Mm-hmm. Can't add anything to that. I always wonder why doctors do that, but you hear it all the time. Exactly.
All the time. All the time.
Hey, thanks for watching. And now click on one of these thumbnails to learn a ton more about TRT and hormone optimization.